Okay, this video was just something that it seemed a little interesting to me that I see a totally different pattern of disease from what I see in Western hospitals when I'm on the internet. And I'll just share it with you, see what you think of this, okay? So when you work in a Western hospital, and I've worked in lots of different hospitals before, I always see the same thing. I see lots of patients that are fat, hypertensive, almost all of them, all the middle-aged and older patients, they're hypertensive. Almost all of them are pre-diabetic or diabetic, with, of course, hypertension and diabetes go hand-in-hand with coronary artery disease. Lots and lots of back pain, neck pain, gastroesophageal reflux, GERD due to hiatal hernia reflux, abdominal pressure syndrome, lack of fiber. They're all eating a SAD diet or paleo, keto, carnivore, or some other nonsense. Cerebral vascular disease. By the time they're 55, 60, fat, sick, and stupid is the standard. Cataract surgery. My frankly demented patients, most of them have one side or both side cataract surgery. The eyes tend to go before the brain. Weak, low energy. They got mitochondrial inhibitors out the wazoo. A lot of the medicines they're taking are mitochondrial inhibitors. I've given different lectures about that, mitochondrial inhibitors. I did a newsletter about that. A lot of the pills they're taking are mitochondrial inhibitors. They've got significant frequency, I see autoimmune disease caused by SAD diet or paleo, keto, carnivore. I find that funny because in the real world, it's the SAD paleo, keto, carnivores with autoimmune disease. On the internet, all you hear about is autoimmune disease cured by paleo, keto, carnivore. Yeah, right. It's a disease to cause leaky gut. I doubt it's going to cure too much autoimmune disease. Okay, you see a lot of people impulsive, lack of purpose, unhappy, and they need to find a purpose in life, choose it for themselves, and they should study a major religion like Christianity, okay? But in the real world, they're labeled anxiety, depression, PTSD, attention deficit, and they're put on psychiatric drugs, or even the paleo, keto, carnivore diet with the Harvard psychiatrist Chris Palmer. Slows down the brain. Okay, in the real world, they're deficient in potassium, magnesium, plant nitrates, antioxidants, and fiber, all the stuff that comes from plants. In the internet world, they're deficient from polyphenols, so they need olive oil. Sell them some olive oil. They're deficient in omega-3s. They don't have the right ratio. Sell them some omega-3s. They're deficient in soy. Sell them some soy and pray to the god of soy with no estrogenic side effects. They're deficient in flax. Sell them some flax. They're deficient in iodine. Sell them some iodine. They have gut problems. Sell them some probiotics. They've got sarcopenia. Sell them some protein powder. They're osteoporotic. Sell them some calcium. Tell them to drink milk. Send them some high hormone replacement therapy of estrogen. They're low in energy. Sell them some coffee or some tea. They got autoimmune disease. We talked about paleo, keto, carnivore, or psych drugs for all their emotional difficulties. So anyways, it's quite a different pattern of disease. I'm sure, I'm absolutely 100% certain it has nothing to do with the fact that these are all opportunities to sell people stuff. I'm sure that doesn't influence at all.